Well, good morning and good afternoon, everybody. It is so lovely to see you all and for joining this dialogue on an exchange on national human rights institutions in the monitoring of detention centres during COVID. My name is Pip Dargan. I'm the Principal Advisor on Capacity Assessments and International Engagement at the APF Secretariat, and I'm here with my colleague Faso Aishith, who's the Program Manager for Gender and Pacific, and I thank her for attending this as well on behalf of the APF Secretariat. We really do appreciate your time today and to join us at such short notice, and particularly to all of you APF members, including the National Human Rights Institutions of Malaysia, Bahrain, Palestine, and the Philippines. I wanted to give you a brief overview of why we're meeting today, and then we will give you some logistics as well and a bit of an overview of the program, and then I think we should start having our discussion straight away, given that we only have 90 minutes for this session. So the idea for this dialogue today came from another program of the APF Secretariat, the Chairperson Outreach Program. And we've had that with a number of our member institutions, and most recently with the Malaysian Human Rights Commission. And during that meeting, the Commission was really wondering how other institutions were dealing with the issue of monitoring people in detention, particularly during COVID. And of course, we all know how much more challenging monitoring is during COVID. And we agreed to work together to have a short exchange, a pilot exchange with a number of our member institutions. So we're again very grateful that you could join us. If you feel this dialogue is useful today, then we can look at expanding it into the future and include other APF members as well. So I'd like to first thank the Malaysian Human Rights Commission for nominating this issue, this very important topic and issue, to the APF. As you all know, monitoring is a key function of a national human rights institution, and that role is of course applied to assessing the rights of people who are detained. And COVID-19 has forced many national institutions to adapt their working methods and approaches. And a vast majority of national human rights institutions have resorted to remote monitoring, which of course raises a new set of challenges and opportunities in the promotion and protection of human rights. Many of our members were already existing and working in very difficult contexts prior to COVID. So each national human rights institution will have a very different method and response to those challenges. But despite that, it's very clear to us at the APF that our institutions are resilient and innovative. Today's program will be 90 minutes. We will start by introducing ourselves. If we could predominantly have the commission members and the chairpersons introduce themselves and the senior staff that are speaking. I understand that there are staff members from the Malaysian Human Rights Commission that are observing this session today. Unfortunately, we can't have you introduce yourself at this time due to time limitations, but you're very welcome, and we're very glad that you're here with us. So I will finish now, and then after that, and after some introductions, I will ask Commissioner Joseph from the Malaysian Human Rights Commission to first speak, and then it will be Dr. Amar from the Palestinian National Human Rights Institution to speak. And then after that, we will have two speakers from the Philippines Human Rights Commission, Directors Regino and Rusiano. And then fourth, we will have Chairperson Al Darazi from the Bahrain National Human Rights Institution. And if I could please kindly ask that we keep our questions and our comments at that plenary session towards the end of today. So without any further ado, I will thank you all again very much. I will take the time to moderate and and to make introductions, again, where necessary. So thank you. And if I could ask that you introduce yourselves, and then we will go to our first speaker. Thank you. Fassa, maybe if I could start with you, and then Simon.
Sure. Thanks, Pip. Hi, everyone. My name is Faisal. As Pip has said, I work with the APF Secretariat on APF gender programs, as well as providing our services in the Pacific at the moment. Why I really wanted to participate in this session was because we are looking at updating our manual on torture prevention, and there's a big part on monitoring places of detention. So I'm really looking forward to the discussions today. Thank you.
Hi, good afternoon. I'm Simon. I'm the Deputy Secretary of Human Rights Commission of Malaysia. It's a Malay acronym known as SUHAKAM. So if you notice, all my colleagues have this SUHAKAM in brackets, so they are all the staff members from the Human Rights Commission of Malaysia. Thank you, APF, for arranging this. Looking forward to the discussions. Thank you.
Good morning, everybody. I'm Dr. Horia from Bahrain Human Rights. I'm working in Ahliya University as assistant professor. Thank you.
Good day, everyone. I am Jasmine Navarro Regino. I am the director of the Protection Cluster of the Commission on Human Rights of the Philippines.
Thank you, Jasmine.
Good afternoon. I'm Homero Rusiana. I'm the director of the Prevention Cluster of the Commission on Human Rights. And it will be in September that I'll be retiring.
Oh, no.
Yes.
Oh, so lovely to see you, Homer. Can I have any others from the Malaysian Human Rights Commission or SUHAKAM?
Yeah, good afternoon. My name is Jarrod Joseph. I'm a commissioner from SUHAKAM, Malaysia, and I think I have two other commissioners here. Dr. Madeline from SUHAKAM, commissioner, and Commissioner Lok Yin Ping is a commissioner. We are from different divisions of the commission on monitoring and investigation, and also education. Thank you.
Thank you very much. May I then, if that's all from the Malaysian Commission, may I have introductions from Bahrain, please?
Yes, good morning. My name is Yasser Shaheen. I am the Secretary General at Bahrain in IHR. I am pleased to have this meeting today and looking forward for the results. Thank you.
Thanks, Yasser. Okay, and may I have representatives from Palestine, please?
Hello, good morning, everybody. It's a great pleasure to be with you. I thank the Malaysian Human Rights Commission and the APF for organizing this webinar. My name is Ammar Dweik. I'm the director of the Independent Commission for Human Rights in Palestine.
Thanks, Ammar. Anyone else from Palestine?
Yes, good morning. Bakr Turkmani from ICHR.
Great. Thanks, Bakr.
Ola Adoui from ICHR. My colleague Musa will join. He's the investigations and complaints director, but he will need some minutes.
Thank you, Ola. And anybody else would like to introduce themselves before we move to the first speaker? No? Okay, thank you. Gerald, could I please ask you to kick off the discussion today, please?
Good afternoon from Malaysia. I will do a share screen, and thank you to PIP, APF, and to colleagues to the commissioners and staff members of Bahrain, Palestine, and Philippines. It's good to meet and keep going despite the difficult conditions of COVID. So if I may share my PowerPoint. Wait. Sorry. Okay, I think our framework for sharing this today is against the background of where do we stand as a Human Rights Commission in working during what is called the most trying time of the world. We've come to realize that everyone knows about the COVID, but it's a given that no one really has the right formula to solve the pandemic. So it's a trial, test, and error. So I think we also can learn a lot from this. So in Malaysia, like many of your countries, I think the governments have tried all kinds of control, lockdowns, movement control. So we call it MCO. So you can see the dates there, different varieties. Some are more severe lockdowns, no movement, stay at home. Some you can do different. And now we enter our third round of lockdowns, and it's a long lockdown because it's indefinite. Depends on the recovery plans, and so it's by state. So we're a federal nation of 13 states. So each state government has a little bit of leeway. Our population is about 32, 33 million, plus about an estimate of 6 million foreigners in the land. I use the word estimate because there's a large numbers of also without documents. And so that's the number of people that needs to be vaccinated in the future as well as the present. The good news is that while the numbers are big by our standards in Malaysia, this is a sample from yesterday's numbers. So it's a daily positive cases of 7,000. So you can see we've got up to 5,700 deaths already. But this is mainly in the capital city, capital states where the numbers are very high, as you can see the breakdown. So, but this for me is not the focus. The focus is finally the rollout for vaccination is moving well and fast. I think at an average of 300,000+ a day. So like every 3 days, 1 million people gets vaccinated. And I think that's good news for us, but not without challenge of different communities access, meaning foreigners, migrant workers, refugee, asylum seekers, stateless people, more remote areas. Vaccination is not that fast and not even clear, the policies. But I think our discussion today is to answer this question. Human rights actors and essential service. I think this is where suddenly it dawned upon us that when the government announced any new framework policy or reaction to manage the pandemic, they seem to not mention the human rights statutory bodies like the NHRI, like Malaysian in SUHAKAM, or even getting on board other actors like the civil society actors or community actors who actually are crucial if we are going to manage this well. So this is a list of what the government will normally refer to: food, beverage, health, medical. This is a list of what gets exception during a lockdown to continue. So lawyers can continue, banking, communication. This comes from the government listing, but we don't hear the Human Rights Commission or even the Anti-Corruption Commission or other groups mentioned as an essential service. I think this is where we find our work difficult because of this lack of recognition or understanding of human rights, as an actor. So this is our sad realization. We had to push, we had to try to operate differently. This is despite the outbreak of the pandemic went deep into prisons, into the immigration. Even as today, different prisons and immigration detention facilities will have a large outbreak of COVID positive cases, meaning that the manner of how they manage these detention facilities really is not up to mark in terms of the pandemic, because it can't be business as usual. So the commission has advised them, has given press statement, has written to many of this in the Home Ministry, but very little uptake or wanting to sit down and talk to us or have a partnership discussion on this area. So these are some news cuttings of outbreaks and lockups in many places. But despite this, there's still our work as a Human Rights Commission must continue, because there's cases of death in custody, the allegations of torture. I mean, the usual powers of detaining authorities continue, which means complaints also continue. So where does that leave us? SUHAKAM has done a variety of statements. I think probably we've done about 35 plus statements till the middle of the year on various issues. That's how we speak to the public, to the media. We have regular press conferences once every 6 to 8 weeks on key issues, apart from the press statements that come out. So these are, you can see some samples of different issues: death in custody, migrants, children, police commission bill, this is IPCC, and also judicial misconduct. So that's how we continue our work despite lack of direct engagement with the government. But our mandate to continue our work must go on. The visits, the audit visit, the case visit, the mandate we have by law. We can do case investigating of cases, we can do monitoring visit. But during this pandemic, it was very difficult because our officers were not the first to be vaccinated. And I think this is our call we should do for this pandemic and future pandemics, that the human rights officers should be vaccinated for us to do our work, and the risk and safety issues can be minimized. We wrote officially to the authorities, but we did not get a reply. So most of us officers and commissioners put our names in the usual rollout for vaccination. And I think at this stage, maybe 50% have got vaccinated, the other 50 are waiting for their turn. We had to develop new standard operating procedures, SOPs, on how to manage cases during the pandemic. We had to move to some online interviews with detainees, not as easy because we wanted a free, independent space. But if there is an online interview, there's an officer there, so it makes it difficult. Online meeting with authorities a little bit more easier. Visits to place of detention became very difficult because of also positive cases in the detention facility. Some pictures of what we were did during the last 1 year when there were spaces where we could move. You could see this was meeting a Rohingya community in the north because they were evicted because of the rise of xenophobia in Malaysia. So we visited them to get what's their condition. This is a house where they live, they rent. We visited the Kajang prison. It's a prison, newly launched temporary block for foreigners. And we wanted to see the conditions, the standards, was it up to mark? And so this is one picture where a detainee is being tested, swab test. The other picture is a hall, but converted to a temporary detention facility. So we wanted to do our monitoring job. We also visited immigration detention centers where the boat arrival of the Rohingyas are still detained there, sadly, to look at their condition and document their stories. And this we didn't last year, but since then we have not been able to go to follow up. This was also our work with the embassy to follow up on what is the role and function of foreign governments here in facilitating quick deportation of their citizens back to home country. This was during the pandemic. Many were stuck for long periods because of travel difficulties. In moving to our online methods, these are our officers doing interviews with the police, with the forensic officers. These are in particular just some sample photos of cases of death in custody and torture allegation. Two of online, usually it will be physical, but now it's online. So I think with that, I can bring an end to our presentation, just to say that if the commissions are going to be effective in our work, then that role and function of human rights actors must be institutionalized as part of essential services. That language is not there, that framework is not there. A government does not bring on board human rights actors. It is a role and function of the human rights actors. And this is what we in terms of discussing the health consideration instead of discussing security consideration. So we end up speaking through a public voice, through letters, formally to the ministers. But sadly, that should not be the way. And I hope lessons learned here could push us to institutionalize our position and powers from the mandated act, as well as our function as an oversight body. I think that's some reflections for us. Thank you very much, Pip, and back to you.
Thank you, Gerald, so very much. And I thank you also for that important note that you make about human rights institutions being regarded and recognised as essential services. And I'm not sure if other institutions have had that experience, and I doubt it, but I think that's a really important message to take away. Thank you, Gerald, very much. And if I may now move to the Palestinian National Human Rights Institution with Dr. Amar, please.
Okay, good morning, good afternoon again. It's good morning in Palestine. The COVID-19 had a transformative effect for all of us, with detrimental consequences for vulnerable groups, particularly persons in detention and persons deprived of their liberty. Here in Palestine, we had to face multiple challenges with the COVID-19. First, the government declared state of emergency. So we had to monitor the implementation of state of emergency to make sure that there's no abuse of this declaration of emergency, and that the government does not use the exceptional power given to it outside the declared purpose of the state of emergency, which is facing the pandemic. And of course, when we talk about state of emergency, that means we need to do very close monitoring to places of detention to make sure that there is no arbitrary detention or prolonged detention using or abusing state of emergency. With the situation of persons in detention, I would like to point to several issues. First, we were faced with the question, and I believe all NHRIs faced the same question at the beginning of the pandemic, when governments assigned location for quarantine. And the question was raised, are quarantine places places of liberty deprivation or not? And SPT made a statement at the beginning of the outbreak saying that quarantine places should be considered places of detention, or like places of liberty deprivation, and therefore they should be subject to monitoring. And in this regard, we followed the guidance of the SPT in Palestine, and we did close monitoring to these places. And mainly we used technology in that, because at the beginning of the pandemic, everybody was scared. We did not know really what is the best practices and how to go to places and to keep distancing, or to what kind of clothes we should put. So we did not visit these places, but we were in touch with the persons inside these places through social media, through WhatsApp and Facebook or Messenger. We established, actually, we had a good experience in Gaza. My colleague Bakr actually was leading that, who is with us today. He created a WhatsApp group for persons and families inside quarantine places. And whatever complaint they had, we invited to that group representative from different like government or official departments who were concerned with these places. And through this WhatsApp group, many of the problems, complaints were addressed and were followed up quickly through this line of communication. With the traditional places of detention, prisons and other places, we followed the following strategy. First, we advised the government to reduce the number of inmates. And I can say that we have a very good success in that regard. In the West Bank, the number of inmates was reduced by 30% in the first month of the pandemic. In Gaza Strip, it was by 50%. And that was done through the following steps. First, the Palestinian president, we encouraged the Palestinian president to issue pardons for like non-dangerous and petty crimes. Second, in Gaza mainly, because they have a law that allows that, many inmates were sent to vacations. They were given vacations. The law there allows there. And also in the West Bank, and that was actually, we were able to have a strategic impact because for the last years, we have been advocating for the canceling the law that allows for detaining people on contractual obligation. We still have a law in Palestine that allows detaining people on civil debts or financial debts. And we, using the situation and the pandemic, we advocated for canceling that or at least suspending the provision in the law that allows this detention. And there was a temporary suspension of that provision, which also reduced significantly number of inmates. With the place monitoring and visits to places of detention, at least the first 4 months of the pandemic, I'm talking about from March to July 2020, we had no physical visits. We substituted that with phone calls with the place officials. We asked for a daily number of inmates. We asked for names to monitor the duration of the detention, to make sure that there's no abuse of state of emergency, that people are not arrested for more than the period subscribed in the law. Also, we, through the prison officials, we distributed leaflets to prisoners, telling them what are their rights, some health guidelines, and we give them number of our field workers that they can call them. This is not, of course, an ideal situation because we do not guarantee privacy, but that was the possible thing at that time. Later on, when things relaxed with the health measures, our staff, they started to do physical visits, taking, of course, all preventive and health precautions and measures. We were not able to do the other technology means like WebEx or Zoom because prison officials were against that. They didn't like the idea. They thought that there might be recording, there might be prisoners might say something and over the Zoom, and there might be recording or something. And also they lacked the proper technology and infrastructure. So there was a technological problem, and also there was some reservations from the prison officials. So we relied on phone calls. Also, we relied on asking for daily reports or daily lists of names from prison officials, and also talking constantly with families. Another strategy was to talk to people who are recently released from prisons. If we know that somebody has been released recently, we would call him or her and ask about the situation and if they wanted us to do something. And so that was also an important source of information for us. Another challenge we were faced with was the Palestinian prisoners inside Israeli prisons. There are 6,000 Palestinians in Israeli prisons. And at the beginning of the pandemic, there was no information coming out about their situation, what are the conditions, and the Israelis stopped all kinds of visits to them. So we, with other partners, we launched a campaign, international campaign. We talked to international missions in Palestine to put pressure on the occupying power to allow for visits and information about Palestinian. One last thing was during the war on Gaza, around 50,000 persons were internally displaced during the war because either they lost their homes or because they were afraid, so they went to UNRWA schools. UNRWA is the UN agency responsible for taking care of Palestinian refugees. So they took refuge to UNRWA schools, and the beginning, the situation and the conditions in these schools were very poor. So we did also monitoring to these places, visits. We made calls and statements to UNRWA to put pressure on them to provide the basic, at least, services to the internally displaced persons. In addition to these issues, we, of course, there were many other aspects related to the pandemic that we had to deal with, like domestic violence. We provided also, along in partnership with the Office of High Commissioner for Human Rights, and that was at the beginning of the pandemic, we published 5 guide notes, and we shared them with APF. We did them in both and in English. Guide notes about the pandemic and state of emergency, about women's rights during during the pandemic and state of emergency, about children's rights, about persons with disability rights, and how the pandemic impacted them, and what are the role and responsibilities of duty bearers. Now, situation in Palestine has relaxed in terms of restrictions and in terms of restrictions on movement, restrictions and access to places of detention. So things are back not to normal, but at least now we can physically go and visit places of detention. Good news that although there were infections during the pandemic, no case or no death case was reported during the pandemic in prisons because of the COVID-19. There was no death cases. Alhamdulillah, thank God for that. And I think that is due to the reduction of the inmates, due also to some preventive measures taken by the detention facility officials, who also made efforts to make sure that there's distancing, there's also a quarantine. I conclude by that, and I'll be happy to listen to other presentations and for the discussion. Thank you.
Thank you so much for that very rich presentation, and the presentation about the strategic approach that the Palestinian institution has taken, and some very innovative steps that you've taken, including the reduction of inmates both in Gaza and West Bank, and the pardons for non-dangerous crimes as well. Very useful, as well as the discussion, I thought, with ex-prisoners, talking to them about getting their insights, I think is incredibly innovative and very thoughtful and inclusive. Of course, the additional challenges that you have in relation to the Palestinian prisoners in Israel, and the international pressure that and campaign to allow for visits is also very well recognised. And the also detention, or the monitoring of those at the UN schools, I think is important, and also to acknowledge the issue of partnership with international agencies, with the Office of the High Commissioner for Human Rights, and the very prevalent issue worldwide of domestic violence and increase of domestic violence in all of our countries during COVID, and the guidelines that you shared with the APF, and thank you very much for that, and impressive that there have been no deaths recorded. And I think you're probably very right about why that has occurred, due to the release of non-dangerous criminals and others. Thank you very much, Amar. If I could please move now to our colleagues at the Philippines Human Rights Commission. We do have 2 speakers, that's Jasmine and Homer. And Jasmine, if I could ask you to speak first.
Okay, again, good day, everyone. Since we have 2 representatives from the Commission on Human Rights of the Philippines, my discussion would be focused on the protection mandate of the Commission on Human Rights, that is the investigation of cases. Now, on the question, are we still relevant as an NHRI? I think positively, yes. Our answer is positively yes. Why? Because during the pandemic, we have received many cases, violations on quarantine protocols, more than, I think, almost 2,000 cases during starting March 2016 up to now. Now, the challenges that we face as regards PDLs is that a face-to-face visit has been suspended because of the pandemic. So in case we received a report regarding human rights violations inside detention facilities, we cannot, the question on immediacy or urgency comes to fore, because we cannot go there immediately. And not only that, because our staff we still go, even if there's pandemic, even if there's the what we call enhanced community quarantine given by the government, still we deploy people to investigate. But the problem there is, because we have to abide by the health and safety protocols, the result of the investigation would be affected, because we have to undergo RT-PCR. And by the way, when we do this, our office pays for the swabbing test, because if we will be the one to pay for it, I think it's quite pricey here in the Philippines. Also, because we cannot anymore do surprise visit. As far as the use of technology, we actually maximize the use of technology. When we conduct visits, we use what we term it e-dala, or what we call e-visit. I think some of our colleagues here also mentioned online visits, which is, I think, the normal thing to do right now because of this pandemic. Also, we increased the number of our hotlines. We have 16 regional offices all over the Philippines, and a regional office consists more or less 4 hotlines, because people cannot go out, so they are always holding their cell phone. So in case there is a human rights violation, abuse, or violation for that matter, they will just text it to us. So we increase our hotline numbers, and also we partner with a number of CSOs as far as the documentation of human rights violation. We actually had our e-lawyering services. That is, we respond to cases of HRVs and abuses through our e-lawyering platform, and we partnered with certain universities here in the Philippines. We expanded it because we do not have so many lawyers in the commission. So we partner with the different groups of lawyers here in the Philippines, so that they could respond and they could represent people who are charged for violation of quarantine protocols. Also, as far as the advisory role of the Commission on Human Rights, we actually issued an advisory on early release of PDLs due to pandemic. These are people or PDLs who committed minor offenses. And in case there is a statement given by our government regarding the arrest of people who are not wearing face masks or face shield, that they should be arrested and that they should be incarcerated, the Commission on Human Rights is quick to respond by issuing several press statements and advisories on the matter. Also, we have been receiving many letters coming from our PDLs. They are requesting that the Commission on Human Rights would facilitate their early release by applying for parole, which I think the protection cluster did we had released quite a few PDLs because of this. And also our Supreme Court of the Philippines here enacted or issued a rule regarding the plea bargaining system on drug-related cases. Before, it was not given to them, but because of the pandemic and majority of our PDLs are actually, their cases are more or into drugs. So I think this policy issued by the SC more or less decrease some of the PDLs. Also, on the safety of our staff, we when they conduct investigation, we give PPEs to them. And also, of course, they do not commute, or what we call, they do not use public transportation. We shuttle them back and forth. And also, our Department of Health issued a handbook, workplace handbook on COVID-19 management and prevention. And because of this pandemic, many cases now are cropping up regarding mental health. And we are actually coming up with a manual and protocol, especially in the visitation of mental health facilities. And likewise, as the NHRI of the Philippines with regard to visits, we do visits rehabilitation centers, likewise centers for older people. But what is now in the pipeline is the manual on mental health services. And as regards the COVID update here in the Philippines, I got this data coming from our Department of Health. We have actually 1,454,399 affected with COVID. The Philippines, by the way, has 109 population. As far as vaccination is concerned, I think the rollout is quite slow. And we only vaccinated, I think, 12 million Filipino peoples. 25,459 died. And sadly, some of my staff in the protection died due to COVID. And by the way, our agency also gives financial assistance to the families left behind by the staff who died of COVID. I think that's it. Thank you.
Jasmine, thank you very much, and condolences for the deaths of the staff, who I know from experience are very committed at the Philippines Commission. So our condolences to you. Thank you very much, and for again highlighting and a very rich engagement, talking about maximising the use of technology, increasing the number of hotlines so people can access the Commission, and again the important issue of partnership with civil society, including an innovative e-lawyering initiative, which includes universities and lawyers in the Philippines. And again, an important issue around the early release of those people who have minor offences. And also the advisories and the statements that you make, and also in relation to the important issue of mental health and developing guidelines on that. Thank you very much, Jasmine, appreciate it. Homer, if I may ask for you to now speak. Thank you very much.
Yes, thank you very much, Pip. Thank you very much also for giving us this forum for us to share what we do in the prevention cluster of the Commission on Human Rights. The prevention cluster of the Commission on Human Rights is quite young. It started last year when the pandemic started, actually. So when, I don't know if, and that was when I was also designated to head the cluster. I don't know whether I was the one who brought the pandemic to our work, because when I came in, the pandemic came into. Anyway, just Attorney Jasmine reported earlier, we were more of the, let's say, the techie type of visitation, visiting the jails through e-visits, and visits are quite let's say, sometimes like Mr. Amar said, sometimes you would just listen to what the PDL say, and they seem to be coached, or they would rather keep quiet about it, and they would not talk or things like that. That's the disadvantage of having this e-visit. So aside from that, that's one of the challenge. But one of the worst challenge is when you would receive letters or emails telling you that, wow, we have these detention places that have, let us say, several deaths already, and they have not been cremated or things like those. So we have to make follow-ups we have to make follow-ups with the places of detention to make sure that that these people whom they suspect as to have died from COVID, that their remains should be cremated, so as to protect all the other detainees. So the real situation here is that it's not only let us say the places of detention also have their own protocols. They do not want visits coming from outside, and in fact, hearings of cases are also done technologically. So the courts and the judges, they face each other the through the technology, but sometimes one big problem is that the connection is very poor. In the same manner that when we conduct our e-visit, the connection is very poor, so sometimes it just gets garbled and everything. So what is the more, let us say, reliable form of keeping in contact to get information is through letters or through telephone calls instead of, let's say, the usual things about e-visit, because the e-visit, the PDLs have to queue for them to reach to tell their while they could always write how they feel or what they feel, but it's the COVID case in places of detention are not really that bad, because there are also the government supports and the CSO supports and the ICRC supports the holding of having this isolation places in places of detention. So when once somebody feels something like that, they have this nurse, they have this doctor to look into, and then these PDLs are brought into the isolation places away from the general population of the general population of those of the places of detention. But just the same, despite those challenges, we still have to go through a lot of process. Like, let's say our office is in charge of looking into the requests for pardon and parole, when the PDLs would say, we'd like to avail of this and of the parole, and how would you go about it? So we have to write the Bureau of Pardons and Parole to consider them, and like, let us say, the privileges of good conduct time allowance of persons in detention, wherein if they behave properly, their detention are credited so that their detention is shortened. And we also still we also have activities about decongestion. But right now, what the Commission is most busy with is the establishment of the National Preventive Mechanism. What we have is, in lieu of that, since there is no law yet, no act on the National Preventive Mechanism, we have the Interim National Preventive Mechanism that the Commission support. It consists of a lot of professionals, including medical practitioners, psychiatric lawyers, and things, and people who are so dedicated to monitoring government compliance to the OPCAT, Optional Protocol in the Convention Against Torture. So they have been quite busy, and one of the best things that we had about this INPM is they were able to conduct a physical visit during these hard times. So they visited what we call the Bahay Pag-asa. It's a detention place for children or children in conflict with the law. And they were able to gather some information, because before they did the physical visit, they had this e-visit first to check on them, and then they have to validate the testimonies or the information coming from the children who were detained there, and they were validated by a physical visit, and we're about to be through with we're about done with two Bahay Pag-asa, and we're doing well, but the real problem is that sometimes the detention places are too strict. The Bahay Pag-asa are too strict, and sometimes we just suspect that maybe after validating everything, it was just we just want to be sure that there's no show about it, that this is all that this information are all true, and that the children are really talking from the heart, instead of, let's say, being fearful of any reprisal if they say the truth. So the INPM is also involved in module writing, because there was a request from one of the places of detention in the Philippines for trainings on INPM. So we already have the module in place in a way that there's already a draft for that, and we're trying to let us say refine the contents. And there's also a development of monitoring tools of psychiatric institution, because of the National Mental Health Act of the Philippines, mental institutions are now psychiatric institutions are now considered places of detention. And there is also monitoring tool on places of detention because of the COVID. With the help of Dignity, we were able to develop the monitoring tool, and I think last May we have launched it. There was a soft launch, and we'd like to cascade that in our regional offices for their implementation, for their use. And there's also a research paper regarding improvements to the justice system, because the INPM believes that the justice system must have to be improved, because what we are experiencing right now because of the pandemic may produce other, let us say, may cause any the environment, the development of other environments so totally different from the times that we used to enjoy this without the pandemic. So there is some we have some steps regarding that. So let us say we'd like to look into the writs of kalayaan and the writs of habeas corpus, release on recognizance, and the bail system, and community service as an alternative to deprivation of liberty. And also, the INPM has already adopted its own manual of operation. But just the same, we still have in our legislature the NPM bill, and they have the legislature has already considered the version, the version that the CHR developed, the one that will be used in, let us say, enacting a law on NPM. So that's what we have in the Philippines right now under the prevention cluster. Thank you very much. I may have exceeded my time, sorry.
Thank you, Homer. Thank you so much for briefing us on the work of the prevention cluster that you're heading at the Commission, and recognising the challenges that you've raised, of course, like many others are concerned about potential coaching of those that are detained, and obviously the challenges in relation to those who die when imprisoned, and the issue around cremation and the protection for other detainees, and also the challenges regarding internet connection, which can be very difficult. Was very interested to hear your update about there is no law that's passed yet for the national prevention mechanism, but there has been the establishment of an interim national prevention mechanism that is comprised of multi-sectoral and very dedicated people monitoring the compliance of OPCAT. So that is very impressive, and I'd love to ask you a question about that at some point, but also that they've undertaken a physical visit to a children's detention centre and is developing modules and tools as well. So thank you very much, Homer, for that. I appreciate it. If I may now please ask the chairperson of the Bahrain National Human Rights Institution, Mr. Al Garazi, to please take the floor. Thank you.
Well, thank you very much. And I would say good morning here in Bahrain. I don't know in the other places, maybe it could be good afternoon or good evening to every one of you. Well, here in Bahrain, we were infected like all the other countries in the world with the pandemic. And the problem with this virus, it's the characteristic of the virus is changing all the time. And therefore, the protocols and the precautions are also in parallel changing. That makes a little bit difficulties for us also and we lose a lot of our tools, the previous tools that we were having, like unplanned visit to the fields, etc. We lost it, and even with the non-physical visits by virtual visits are not the same, and it's difficult, and all that type of challenges, like all the work we faced as well here in Bahrain. And we try to change our protocols together with the Ministry of Health here, but as I said, still we lost a lot of our tools. That's the biggest challenge that we are having now. Now, on the communication part, we have tried to increase the hotline. We are having hotline. We are having all type of other social media. We have tried to enforce it more bigger, to receive better complaints and to remove the barrier of having the complaints directly to our National Institute for the Human Rights in Bahrain. So I will not make it because my other colleagues, they talk about similar challenges that they are having with us. So I will not repeat myself. I will talk only about Bahrain. Bahrain did very well in the vaccination. We have opened much more than Europe and other countries for receiving more of vaccinations. We have recognized the Sinopharm from China. We have recognized in Bahrain, we have recognized also the Pfizer BioNTech and Sputnik and Covishield, which is similar to, I think, AstraZeneca, but it was made in India. So Bahrain have opened more on the vaccines, and we have over 60% from the population vaccinated already now, which it's very high. But still, on May we had a very high wave. The second wave was very, very strong on Bahrain. We reached over 3,000 patients per day, but we overcome now, and the numbers shows less than 120 on yesterday. So drastically dropped down, which is still, it's very good. Now on the, as I said, the corrections and rehabilitation centers or the places for detections being infected similarly like anywhere or like any other places where we have a lot of people. Like, for instance, the schools or universities were there, and schools and university, they bypass it by going for a virtual study. But in such centers, you cannot do it. The only way is to prevent proper protocols and to modify such protocols in line with the changes of the characteristic of the virus itself. So this is what was happening, and we were monitoring the same thing, and we were urging the authorities to modify their protocols and have third parties auditing on their protocols in line with the changes of the viruses. And this we found a lot of positive actions from the authorities on the same, but still, challenges are there, and we are working towards to make it better. But now we urge also the authorities to expand the application of alternative sanction to the so they reduce the number of people, and at the same time to have the quarantine and isolation in a proper manner, and moreover to educate the doctors on the changes of the characteristic of the virus. So this is very short. I don't want to make it long. I'm the last guy, and I want to open the ground for others to fulfill our schedule. Thank you very much.
Thank you very much, Chairperson. I really appreciate you providing that overview, and congratulations to Bahrain for having over 60% vaccinated. Here in Australia, we're only 7%, and it's creating a lot of confusion here. So congratulations to Bahrain, and thank you for highlighting some of the challenges as well, and also regarding the virtual visits and also the extra communication platforms you've added in relation to the hotline services, so that more complaints can be received, and also talking to government about adapting their protocols. So thank you very much. It's very appreciated. Colleagues, we are now at the stage where we can ask each other questions. So it's now 4:03 p.m. my time. I think we could allow 20 minutes for an open discussion. So please indicate that you would like to ask a question. There's been a lot of very interesting issues raised, a lot of innovative practices. Please take this opportunity while we're here to ask your question. So I look forward to seeing a hand raised. So please do. Faso, if you can help me as well, make sure that we capture as many people as we can who would like to ask a question. So I leave it to the floor. I noticed that I have Gerald who has his hand up. Gerald, would you like to ask a question or make a comment?
Yeah, thank you. I think one of the lessons I'm learning from this period from Malaysia, as well as our colleagues who have done extremely well in difficult conditions, is that the time and space afforded from the lockdown also pushed our commission to clean up our internal works, the SOPs, the policy documents that was last time always put in the back burner because of too much of demand. So I think in one way there was a kind of a silver lining that also pushed us to make it better. Number two, I think it also pushed us to continue. I think our colleagues from Palestine and others also mentioned about overcrowding in prison, and Malaysia prisons are like 30% overcrowded, immigration also big numbers. So I think policy reform actually is a great time to push, because people are getting worried, and we could use that overcrowding interlinked with pandemic as our reasoning why better prison system actually works well for public health, as well as also not only on civil political rights. Our work is also should be on economic, social, cultural rights, on the overcrowding in the migrant workers' dormitories, horrible, where the spread is so easy. But for the first time, Malaysians suddenly realize they've been having a raw deal and a bad deal. So I think it presented us with also opportunities for policy framing from the ground on the complaints raised. So I just wanted to add that to the discussion. Thank you.
Thank you, Gerald. Excellent points indeed. In fact, the APF Secretariat has had more time to look at its own policies and practices, but I think that's a very valid point to make. I'm now looking at the screen to see if I have any other hands up for questions. Any indication that you would like to ask a question of any of our speakers from Palestine, Bahrain, the Philippines, Malaysia?
I would like to.
Sure, Imam.
Yes,
please.
I would like to hear from colleagues who have NPMs separate from the NHRIs in their jurisdiction, how they coordinated their work during the pandemic with the NPMs, whether it's separate or even it's within the same NHRI.
Thank you. I'm not sure, do we have any institutions here that are NPM? We know the Philippines is not yet. Malaysia, I think not. Bahrain, no. And we don't actually have a institution that is an NPM, but do any of you work with other NPMs within the country? It may be nominated as the Ombudsman, for example.
I thought Malaysia is also combining an NPM and an NHRI. Maybe I'm mistaken. No.
Just to add on, I think no. We've been trying to push for it, but we've also not ratified the UN Convention Against Torture. So this is something still at a very basic level, but we will need your ideas to push that. Thank you.
If I may, Amar, that made me think about the question I wanted to ask Homer, which is understanding that the Philippines does not yet have a NPM established by law. You spoke about the interim NPM. Can you explain a little to us, is that a voluntary, almost grassroots development that's been coordinated, for example, by the Commission on Human Rights, or what role does the Commission on Human Rights have in that interim body?
Well, actually, the NPM was created by virtue of a CHR resolution only within the CHR, and then it authorized the Commission to hire specialists and experts. So we have them already in our. So they're not employees of the Commission, but they were taken in because of their expertise. So some of them come from the CSOs or the NGOs. Some of them because of their background on, let's say, torture. Because some of them are from our previous employees of detention, places of detention and things like those. So we have created a group of we've organized a group of people who have of expertise that would deal on the mandate that is required under the OPCAT, the Optional Protocol Against Torture. So so they're paid from they have a contract with the Commission, and they have just been renewed right now, and they're working let us say they're supported by us. The prevention cluster supports them. The prevention cluster acts as a secretariat for them. So the work is more or less them exercising their expertise on issues about prevention against torture, on issues about places of detention, including let us say conditions in jails, and the support that they give us to the psychiatric detention facilities and things like those. So that's what they do. How's that? We have taken in some of their expertise into our system, but they work independently. So they just ask for support from us. We need this, we need this. But the procedure that they do is that they have it on among themselves. So the commission does not question. So the commission, in fact, it has been furnished copy of their operations manual, and there has been no, let us say, negative reaction to it. So they're working independently. They're using their expertise, all their background and things like this, and even their connections.
Thanks, Homer.
So they're successful in a way,
Yeah.
because when they visited one detention facility in Bohol, the warden was so thankful that the recommendations of the INPM was taken in, and there is some improvement already in the detention facilities.
That's really interesting to know. I thought they might have been challenged if they didn't have an actual legal mandate to buy the. So that's very interesting. Thank you, Homer. I can see that Commissioner Lock Yim Feng from Malaysia has her hand up. Please take the floor. Commissioner Feng?
Okay, apologize, I didn't unmute the thing. Good afternoon, everybody. I have 2-3 questions here. Question number 1 is, I'd like to find out from Mr. Amal from Palestine. I think it is good that you have shared a very successful story regarding to reduce the number of inmates in the prison or the detention center. But you did not mention the figures there. May I know maybe how many detention center or prisons that you all are able to reduce the number of inmates there? Is it how many detention prisons that involved, and how many approximately how many inmates involved? And then will it cost? Is it a high cost to do that or not? That's one. And the second question is regarding e-visit, because nowadays we are not able to visit this detention center or prisons. Then we use technology to deal with it through e-dialogues. But are we able to deal with e-visits or not? I just want to find out. Maybe someone can share their experiences with us. The third question is for Bahrain. What we know is that, congratulations, you have reduced the number of COVID-19 cases in the country. Can you share with us the successful stories? As in Malaysia, until today, all of us are living in fear. I'm serious, living in fear. When we heard about the cases being announced every evening, the cases are spiraling up, never go down. And it is quite a serious concern. And our hospitals now, especially hospitals in the urban area, especially like Kuala Lumpur and the state of Selangor, we can see that even the hospitals are, you do not know the already the number of beds occupied is already almost 80 to 90%. So it's at a very worrying stage. So if possible, we also want to learn from your country that how you can overcome this you can successfully reduce the number. Thank you very much.
Thank you, Commissioner. May I ask Amar to take the floor, please?
Yes, thank you. Thank you for your question, Commissioner. We have 3 types of detention places in Palestine. We have the correctional facilities, which like roughly in the West Bank has 1,200 as we speak, and the same number almost in Gaza, like 1,200 inmates in the West Bank, 1,200 also, or 300 in the Gaza Strip. These are the correctional facilities. This number at the beginning of the pandemic was reduced substantially, as I mentioned, like 2025 in the West Bank and around 50% in the Gaza Strip. We also have the military presence, where anyone who belongs to security forces who commits like crime is detained. So these are prisons for member security forces. The third type is the temporary detention places, and these are places are in theory supposed to have prisoners for a period does not exceed 48 hours. But in practice, because of the overcrowdedness in the correctional facilities, some prisoners are kept for a longer period. It could go up to months staying in what is supposed to be a temporary detention place. So we worked with the three types of prisons. With persons in the correctional facilities, most of them are convicted. So the pardon was the best solution. With the persons in the temporary detention places, many of them were persons imprisoned on civil or financial debt. So suspension of the legal provision that allows detaining people for contractual obligation was suspended, and therefore was substantially reduced in these places. Military prisons, and these are administered by a military like agency called the Military Intelligence. They have this military prisons. We had the dialogue with them, and there was also pardon for some of the military cadres who are in the prisons, or like release on vacation. So it depends on the regulations. So overall, as I mentioned, like 20-25% in the West Bank and up to 50% at the beginning. And then when I say about at the beginning, I'm talking about the first 4 months of the pandemic. Later on, because of the relaxation of the measures, the number went back to normal, but still, as we speak today, it's not as it used to be before the pandemic. One note that we also we succeeded in getting support, financial support from Norway. We did fundraising on behalf of the police because of the very bad conditions in the temporary detention places. So Norway approached us and they asked our advice. They wanted to do some support related to COVID-19. So we advised them to support the enhancing the conditions in the temporary detention places. And they allocated around $600,000 for that. And now there is ongoing work to improve the conditions in the temporary detention places. I'm talking about here in the West Bank only, not in the Gaza Strip. The cost, I think that reduced the cost for the state because the less numbers, the less expenses in the detention places. There is no cost for the state for releasing prisoners in Palestine. We don't have like tracking system or so it's actually it's better and it's more it's less expensive for them to release prisoners. For the visits, unfortunately, we're not able to do that because of the lack of proper technology and infrastructure in the detention places, and also because some legal issues and some also opposition from the officials of the detention places. I hope I have answered your question.
Thank you. Thank you.
Thank you, Amar, and thank you, Commissioner, for the questions. I will refer now to the chat box, which has got a number of questions, a couple of questions that I'll read out. One is very specific to Bahrain and one is a general question. And I think these may be our last two questions given our time today. But there was one question from a SUHAKAM staff member asking the chair of Bahrain, since 60% of the population have been vaccinated, is there any initiative by the government to vaccinate the prisoners or detainees? So that's a question to Bahrain. Then there's a second general question from SUHAKAM as well, thanking the speakers. have a question regarding vaccinations. Is there any cooperation between the National Human Rights Institution and the Health Department in providing vaccines to National Human Rights Institution staff? And how many percent, or what's the percentage of staff that have received vaccinations in your commission, if you know that? So first I'll go to the chairperson of Bahrain. The question again being, since 60% of the population have been vaccinated, is there any initiative by the government to vaccinate prisoners or detainees? Thank you. Chairperson.
Yeah, thank you very much. For the prisoners, from beginning of the vaccination started in December, end of December, we started the vaccination. At the same time, whatever vaccination at that time, we were having the Sinopharm from China. And then later on, we had the Pfizer, BioNTech. And the prisoners, they were having the choice of vaccinating or not vaccinating, and the choice between which vaccine to take. So at the moment, the last information we have, I don't really have the exact percentage, but at the beginning there was, like anywhere in the world, there was some, anti-vaccines are always there. So there were a lot of people that from the people who was under detections, they were anti-vaccines, and but it has increased, especially at the beginning. I think we were having for a long time the places for detentions and correction and rehabilitation centers. They were for quite 5 or 4 months. There were no infections. Then the infection started, and the precautions, as I said, started. And but the precautions from beginning was there, but it has been increased, and as I said before, it has been changed. Now, when you are talking about the number of vaccination at the moment, the exact percentage is not with me. I don't have it. But what I understood that the number are increasing, and the vaccines is available for everyone, and it's always available. So this is from the first, but the previous questions that my colleague from Malaysia was asking, how Bahrain, if I share the experience that our authority has taken here. Now, the good thing, from beginning of the pandemic, they have created a team, like they call it Bahrain team, which they were different type of doctors, consultants, and they were leading these pandemics at the beginning. And it is like a war center, I will call it, because they keep changing all the protocols. And after the second wave we had, which was, as I said, end of, or in May, I can say the mid of May, it was starting Ramadan. If you know Ramadan, always we have gathering, etc. So this is one of the factors, and the other factor, I'm sure, the virus changes, that it was Delta, which impacted. And as you know, this virus is very quick transpirating and infecting, and it is a very dangerous virus. Anyhow, after that, now newly we have they have produced a new protocol. They call it a traffic light, and that traffic light gives the automatically changing the protocols without announcing. I mean, with announcement, but the announcement is not by the center themselves, that they were taking the number of infections and they changed the protocols. Now they have red and they have orange, yellow, and green. So it's like 4 stages. This 4 stages goes automatically without, not like, so it will prevent delaying the changing the procedure, which we had, because at that time in May, the numbers were increasing, but the protocols take little time to change. And but now with this new protocols, I think they are gonna have it automatically. So this makes, by beginning of June, we were in the peak time. We were having over 3,000, where the number yesterday it was less than 120 in new cases. And I think this is one of the reason. And the second reason, Bahrain was very open to almost all the vaccines available in Earth. So we recognize very quick the vaccines, and I think this is one of reasons that the vaccines are available. But if you put up precautions to recognize vaccines, where this is happening in Europe as well, this make the slow movement of vaccination. This is my opinion. Thank you very much.
Thank you very much, Chairperson, for the response. And I will now go to the general question, which is in relation to, does anyone know the percentage of staff that have received the vaccination in each of the institutions? You may not know it, but if you do, could you let us know the percentage? Homer, I think you have your hand up.
Yeah, because our commission is working with the Department of Health for the commission to access the vaccine. But the more let's say active player in that are the mayors, the cities, municipalities. So let us say I'm almost 65 years old, and there is a list of priorities. So I belong to the second or third priority. The first priority is the frontliner. So with respect to the National Human Rights Institution, as being treated as a private, let us say private client for the vaccination, it belongs to the fifth. So to the fifth, let's say, tier of those who will avail. So let us say if some of those employees who have not been vaccinated and they choose to have this vaccine coming from the CHR negotiated vaccine, then they'll have to wait. But let's say an Attorney Just, who also has comorbidity, we belong to the upper group, so we've been vaccinated already. So we have already our second dose. I had my second dose a month ago, and things like those. So we have several opportunities in the Philippines. So it's really up to you on how to let us say find the best option for you. So I availed of all options, including that of our city, the Pasig City. So I was vaccinated in Pasig City, but not in the CHR. So it really depends on. But our commission is working with the DOH, and I think we're almost in the let us say in the list, because we're going to pay for it. The CHR is going to pay for it, and the program of the CHR is for 1 employee and 4 relatives. So all for free. So the commission is going to pay for 5 for every employee. So one employee and 4 members of the family. So that's how it's being worked out right now. So I think our chairperson also already has, I think, his second dose, and so with some of our commissioners, because you have to find your way to be able to have to find your way on how to avail of the opportunity. It's not actually because we like everybody else, we fear. We were so afraid of this, so and we're wanting to work also, we'd like to, because it's more fearsome to be contained in your house for a long while doing just doing this Zoom thing and this writing, and I mean it's really more fearsome than being out there and, let's say, if I hope not, let's say, get infected. But that's why we were all working for and finding ways, and this commission was not strict in, let's say, preventing us. We have already worked for your vaccination, so you wait. No, it was not that. So if you choose, you have your freedom to choose whatever opportunity there is to get the vaccine, because, and in fact, we do not have the choice of vaccine like Bahrain, that even the PDLs, the persons deprived of liberty, can have the Pfizer. We have the as I joke to everybody else, I hope I'm not going to offend anybody. I said I have claimed the payment of the country that is making use of our natural resources in the West Philippine Sea. That's what I keep on joking. As I said, I have Sinovac, and I have seen. I don't know if Attorney Justice also Sinovac. Many of us are vaccinated by Sinovac, and we're fine. So I'm already reporting for work every week. I have my regular presence in the office, especially now that I'm retiring. So I have to be working on my records and everything.
Thank you, Homer.
Yeah.
That's great. Thank you so much for your response. And if I may ask, is there any other commission that would like to add? Because we are now at 4:30. Would any other commission like to add anything? Comment on the number of staff that have been vaccinated? Any other really pertinent question you may ask? This is your last chance. No, I think we have done it. Simon, I am going to refer to you for a moment. Simon is my colleague at SUHAKAM. Are there any comments that you would like to make at the end of this session?
Not very specific, but I sense that more or less we are in the same situation. The initiative taken by the NHRIs, the recommendations that we have provided to the authorities to reduce the population at the places of detention, then the e-visit or the online options that the virtual meetings with the places of detention. So these are some of the common things that I noticed that we have been making inroads in the background of the pandemic. But one thing that is not very clear, whether any NHRI is making any active effort in making human rights getting recognition as essential service. Any initiative, any role, any negotiation with the government towards that recognition?
It doesn't appear that any of the 4 institutions represented here, Simon, have been recognised as essential services by government during this period. And I think it's a really useful recommendation that we can take from this, actually, that perhaps institutions yes.
Gerald Joseph here. Sorry.
Gerald, please go ahead. You're in your car.
Yeah, because I'm rushing to make my vaccination appointment. My second vaccination appointment is in 20 minutes. So, okay, just a point that I think one thing we did not utilize in this pandemic and subsequent emergencies, both regional or global, is utilizing our quite well-established networks of the NHRI, in this case, the APF or GANRI, to quickly move into action for calling out things like this, like making human rights essential service, for working with WHO to ensure that our staff and commissioners are considered frontliners for vaccination in order to make the intersectionality between right to health and other rights, defense and protection. So I think this is something that I would like to propose. How can our framework networks and framework within APF or GANRI be quick response in subsequent emergencies? Well, I pray we don't have emergencies like this anymore. But in any case, this could be lessons learned, because I think we wasted the opportunity, as I'm hearing our colleagues. Some moved better, some moved faster, some were stuck, unable to, because it's new. So we were not really sure how to handle it, but we did not utilize the strength and wisdom of colleagues across the region. Thank you.
Thank you, Gerald. I think you're right. I think everybody was shocked, really, and we were all just scrambling around to work out what to do and how to do it. But I think that's a very interesting comment to make, and perhaps it could be something that is developed, in partnership with GANRI and APF, in terms of a statement that looks at promoting national human rights institutions as frontliners in this pandemic and as essential service providers, and that perhaps there could be some kind of discussion around developing a joint communique through the APF, through GANRI, that can be utilised by individual institutions in their engagement with their governments as a recommendation. Simon, do you have a kind of response to that, or Gerald, do you want a response to that?
I saw hand raised by Commissioner from Palestine.
Yeah. Did Amar want to make a comment? No?
Excuse me, was there a specific question or?
Simon, did you have a question for Amar?
Sorry, not I think Bahrain. I saw the hand raised by.
Oh, sorry, from Bahrain, the chair of Bahrain.
Not, yeah.
Yes, please go ahead, Chairperson.
Thank you very much. But I was talking about the previous question when you were asking about the number of people get vaccinated in our commission. That all the employees and the commissioners, they are vaccinated 100%, and we are having as well an extra vaccination now. It's going on that they call it the activation. So this is like a third, the third vaccine, not the second one, but the third one started now as well. Because after 6 months, the antibodies goes down in the body. So it is an extra vaccination now being adopted, and it's going on, especially for the people above 50 years old. The country is small and we have opened very quick, and that's why the numbers we are having this way. But still, last month we were heavily infected. So thanks God that there will not be a new virus that it will bring us down again.
Yes.
Thank you very much.
Thank you. Thank you. I think we will now need to conclude. It's 4:39 my time. I'd like to thank you all very, very much for your participation. It's been a very rich discussion. Simon, thank you very much again, and to SUHAKAM particularly for raising this as an issue. We'd very much like to receive your comments on whether you would like to see another session of this type in the future with more national institutions involved. Please do let us know by email if that's something you would like to do, or any suggestions that you have about any virtual dialogue on any particular issue. The APF is very happy to be of support to you. So please do let us know. I would like to have any recommendations that you would like to suggest from this meeting, if you would like to forward them to me. We've had a recommendation from SUHAKAM. If there's anything you would like to suggest to us, the APF, or to each other, please do. It's been a great privilege to be with you all today. We very much appreciate the work that you do. It's always difficult. It's been more difficult in the last 18 months, but you have certainly shown great resilience and care, and we thank you for that. So thank you very much. I appreciate it, and I will say goodbye. Shukran, terima kasih, thank you.
Thank you, babe.
Thank you, everybody.
Thank you very much.
Take care. Great to see you, Homer.
Thank you.